my morning break. Oh, don't you know, you keep me up on everything I need to know.
Well, measles cases are on the rise in the U.S., including in South Carolina, where a major outbreak has reported almost 800 cases. In this week's Health Break, Tim speaks with an infectious disease expert to find out what we need to know and how to stay healthy.
Now, there have been cases of measles documented all across the country recently, including one right here in the Coastal Health District just a couple of weeks ago that has a lot of people wondering, what does that mean to our community at large? Dr. Christopher Saling is an infectious disease expert with SouthCoast Health. He's going to give us all the information we need to know to keep ourselves and our families safe. Doctor, how are you?
I'm good. Thanks for having me.
Yeah, thank you for doing this. A lot of people are asking this question. Just what does it mean that there is a case of measles here in our area?
Well, I think it means that it's coming. So more and more are going to come. So measles is something that we have to be on the lookout for, and people need to be on the lookout for symptoms, because it's not, what it was where we had vaccines for all this and people were getting the vaccines and, people were protected and we had herd immunity. Now, for the first time in a long time, we're seeing reemergence of measles. So people have to be educated about it. And it's actually one of the most infectious entities that we have in all of infectious disease. It can linger in a room for over 2 hours after an infected person breathes out. And if you're not immune, you have about a 90% chance of being infected. So it has a very high tendency to spread quickly. The first symptom is like anything, fever. So it's nonspecific. But you get a prodrome of fever, and then the way that we remembered it in medical school is the 3 C's. So you get conjunctivitis, which is a redness or irritation of the eye. You get cough, and then the other C is coryza, which means runny nose. So those 3 things. And then following that, which is very pathognomonic, is you get these bluish white spots in the buccal mucosa of your mouth, and we call those Koplik spots. And after that, you get the very pathognomonic rash. The rash is the thing that people should really be on the lookout for, because it's pretty obvious. And the rash is very characteristic for measles.
Untreated, how dangerous can measles be?
Well, measles can result in death. I mean, it depends on, a variety of factors, but, immunosuppressed people have chances for complication. But I can tell you that around 20% of all measles cases end up with you requiring to be hospitalized. So that's quite a lot.
There are certain groups that are more susceptible?
So those people are people in higher education, so college kids or people getting advanced degrees living on campuses, people that are going to travel internationally. That's a huge group. And that's actually what happened with our case here in Georgia. Another group are healthcare workers, obviously, because they're around sick people. And, another big group would be people that are taking care of immunosuppressed people, because the immunosuppressed people can't get the vaccine, because even if they wanted to, because it's live. So because it's live, there's a risk that they could actually contract measles if they take it.
Now that we do have a case documented here, just how much more alert should everybody be to those symptoms you were mentioning?
Yeah, I think that, it just goes to show that measles is real. It's something that's coming, and it's only a matter of time before we get more cases. With less and less people being vaccinated, we're losing what's called herd immunity, which essentially is if there's a certain amount of people that are vaccinated within the population, you protect the ones that aren't vaccinated, because there aren't enough hosts for the virus to jump, through. The biggest thing is we don't want to spread it. So if you have any doubt whatsoever, the first thing you should do is self-isolate as to not infect other people. Don't just show up to your doctor, because you can infect people who are at the doctor's office. Call your doctor and say, these are my symptoms, what should I do next? So I think that's the most important thing that people can do. They try to recognize the symptoms, and then if they think that they've been exposed or they're having symptoms, they should isolate and call a provider.
Doctor, thank you very much. That's very valuable and important information to get out to the community. Appreciate you doing that.
You got it. Thank you so much.